Hello, everyone. Welcome to the introductory episode of Mental Health and Makeup. My name is Jasmine Young, and I am a psychiatric and mental health nurse practitioner. And I've been practicing for 2 years. I see ages 6 to 65, and I assess and diagnose and treat all psychiatric disorders. I am learning, relatively still new, but I specialize in a few. And my goal with creating this type of video is to educate the public about mental health disorders. I love mental health and I love makeup, so I decided to put it together. I put my makeup on every day, and I decided this is a good way for me to do both. Put my makeup on and teach about something that I really love, which is mental health. All right, so psychiatric nurse practitioner. First of all, I'm going to explain what we are, what we do. Okay, and if you're wondering what I'm putting on my face, I'm going to have all of that information in the comments. I won't say what I'm doing, what I'm using while I'm talking about the mental health disorders, but I will place it in the comments. And I will do some other videos that focus on the makeup. But for now, we're just going to do this one, okay? All right. So, I've already primed my face and everything, or washed my face and everything, so I'm just going to start. All right, so psychiatric and mental health nurse practitioners. What do we do? Who are we? Well, we're nurses, number one, but we're advanced practice nurses, okay? And when you're an advanced practice nurse, you have to have an advanced practice degree. Now, you can't see mine in the background because I have it blurred out. However, this right here is my advanced practice nursing degree, and it's from Georgia State University. And this over here is my certification as an advanced practice nurse in psychiatry, okay? All right, well, first of all, I would like to say congratulations to all of the nurse practitioners that chose psychiatry, because don't you just love it? I just love it. And what I do is I'm currently working from home. And ever since the pandemic started, I've been working from home. And I work from 8 a.m. to 6 p.m. Most days. But I'm off on Fridays, which is wonderful. So what I do is I see patients just like a psychiatrist, okay? A psychiatrist, however, is a medical doctor, okay? They are doctors who have specialized in psychiatry. Well, what an advanced nurse practitioner is a nurse who, of course, got the undergrad degree and at some point got an advanced degree, okay? They obtained an advanced degree. All right, and so you can look at me as a psychiatrist, but I'm not a psychiatrist. I'm a nurse practitioner. I'm still a nurse, okay? You know, kind of sort of how you go to the Take Care clinic or the Walgreens clinic or whatever type of clinic is out there. If you're sick, you can't get into your doctor's office and you say, you know what, let me go to the Minute Clinic. There's a nurse practitioner there. Well, they do some of the same things that primary care physicians do, right? Well, you can kind of look at a mental health nurse practitioner as doing the same things as a psychiatrist does, but they're just a nurse, not a psychiatrist, not a doctor, okay? All right. Yes, in the state of Georgia, we are supervised by medical doctors. I have a wonderful supervising physician. And so we get into this collaborative agreement, okay, in the state of Georgia. And the collaborative agreement basically says that everything that I chart is done under my name, but my collaborating physician reviews 10% of my charts, okay, and we collaborate. So this physician is there for me to ask questions about different case scenarios, very difficult cases. Maybe I've worked on a case for a very long time and I just can't get anywhere with the case. And I'm like, what do I do? We have those days where we're just kind of like stumped by these very, very difficult cases. And so we have the opportunity to phone a friend, if you will. And although I don't have to phone a friend often, I do use my collaborative physician just for oversight. And, my being new in the field, oversight was wonderful, the first year or so. And I still will collaborate with her now when I have difficult cases. Oh, yes, I collaborate because we first do no harm. Okay, we first do no harm. That's something that we said as nurses. We would first do no harm, and then we would do good, right? So anytime we have questions, it's better just not to do anything or to gather more information, get some test results, get some labs done, and then make a decision. And yes, what I do in the clinic every day at work is I assess, I diagnose, and I create treatment plans for all of my mental health patients. All right, so mental health. There's a lot of stigma involved in mental health, number one. Stigma. What is stigma? You say, what is stigma? What did she just say? Stigma. Stigma is basically a predetermined thought that you have about something. All right. Maybe you feel like something is bad, and stigma in mental health is just not good. It hurts the community as a whole. So that's one thing that I do in the community as a psychiatric and mental health nurse practitioner. Stigma, I try to break the stigma that's there, okay? By just talking to people, about their lives, about what they do, about the fact that mental health is actually familial. It's hereditary, guys, okay? So if you all have mental health issues, thank your parents. Oh my goodness. It's true. Thank your parents, okay? But you cannot choose who you are born to. So what we do is we diagnose it and we treat it, okay? Most mental health disorders, if you get the treatment and early intervention, can be managed very well. It's just a follow-up. You got to follow up. So what we use is to diagnose mental health disorders is the Diagnostic and Statistical Manual of Mental Disorders. We call it the DSM-5. It's our best friend. It's like the Bible of psychiatry. You get what I'm saying? The grand resource that we use. Now, we use a lot of other resources. I have a really big bookshelf back here. We use a lot of other resources, but we definitely refer to the DSM because we have to have a diagnosis first, okay? A lot of people come in complaining of a lot of symptoms, They may not be sleeping. They may not be eating well. They may have disinterest in doing pleasurable things. They may hear voices. They may have panic attacks and all different types of things. But when they come in for the first time in initial evaluation, we have to figure out, what do we call this? And the reason we have to figure out what we call this set of symptoms is because at some point, we're going to have to prescribe some medication, right? I prescribe medication. Oh, yes. But how do we know which medication to choose? Well, the FDA has placed certain diagnoses in groups, and we can use medication according to the diagnostics. Okay, so the diagnosis is the most important first step. We've got to get to the diagnosis. What are we dealing with? If we don't know what we're dealing with, then how are we going to treat it? And what are we going to treat it with? Okay. So we first have to know what we are treating. And once we label it, it's not to label it to make people feel bad or anything, but once we label it, then and only then will we know which medication to use. Okay. And so there is a method to this madness over here, okay? No pun intended. So in school, we learn all about how to diagnose. Because if you don't diagnose correctly, then you basically, you have to diagnose correctly to be able to treat it, okay? All right, so let's talk about the first thing that I would like to preview. Let's talk about the first thing I like to preview, okay, on today's show. Depression, okay? All right, so with depression, people say, oh, I feel sad, I feel down. I'm down. I don't feel well. Something may have happened, like COVID. Happened to all of us, right? Something may have happened. You may have been exposed to psychosocial stress. And if you start feeling different, and this different feeling lasts for longer than 2 weeks, and it's a change in your level of function, okay? And you have 5 or more of the following signs, then you could have major depressive disorder, okay? All right. Now, there's a caveat. There's a warning here, okay? I want to let everybody know this is not intended to diagnose you, okay? I'm not diagnosing you all from afar. You know, I can't do that. We don't diagnose people from afar. I have to see you in the clinic, okay, to diagnose you with anything. This is for informational purposes only, okay? Informational purposes only. This is to educate the public, you know. So if you say, hey, you know what, she's speaking and I'm listening and it's sounding right and this sounds like how I've been feeling, I encourage you to go ahead and seek professional advice and opinion on your case specifically, okay? This is just for educational purposes, okay? All right. Thank you all for being so patient with me on this first video. All right, so Siggy caps. For a person to receive the diagnosis of major depressive disorder, you have to have at least 5 of the following 9 symptoms, okay? 5 of the following 9 symptoms. And again, if you would like to follow along with me in the DSM, you just go over to page, what are we looking at? Depressive disorders. You just go right on over to page 164 in the DSM, okay? It's page 164. Yes, the diagnostic criteria is actually on page 160, okay? All right, so 5 or more of the following symptoms, all right? So depressed mood most of the day, nearly every day, okay? So this isn't just a mood that you're like, oh, I don't feel good. I don't feel good today. No, this is a depressed mood all day, every day, for at least 2 weeks, okay? To where you really just don't want to do a lot of things and you feel sad, helpless, hopeless, worthless, as indicated by either subjective report, feeling sad, empty, or hopeless, or observation made by others. Okay, so are you all out there seeing people feeling depressed? You're seeing people that are down, anxious, sad. They look hopeless. They may feel like things will never change and you're not used to seeing them that way. You know, are you all following me? Okay, so depression, feeling sad and down. Now, one thing I like to say is in children and adults, this depression or feeling down, this may appear as irritable, okay, in children and adolescents. It may appear as irritability. Like, why is my child so irritable? What's wrong with them? Some of our children are just ornery children. But if it's a change in their previous level of function and your child has not been depressed And all of a sudden, they're having a change and they're irritable and they're agitated. And it's outside of normal irritability and agitation. Now, this is daily for at least 2 weeks. You notice a sudden, different change in your child. Okay? Also, a markedly diminished interest or pleasure in all or almost all activities. Most of the day, nearly every day. Okay? As indicated by either subjective account or by observation. So, this is called anhedonia. And anhedonia is a general disinterest in doing pleasurable things. I know it sounds like a weird word. Anhedonia. Right? Anhedonia. 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 It is a general disinterest in doing pleasurable things. So you're not interested in doing things that are fun. You used to like doing all kinds of things. You used to like going outside and kayaking or being outdoors. And now all of a sudden, you're not feeling it. You don't want anything to do with it. And people are saying, hey, why don't you come along with us? Why don't you come do this with us? And you're like, I don't feel like doing that anymore. I don't want to do anything. I just want to lay in the bed. I just want to isolate myself. You're turning invitations away to things that you know you would have done because you used to have so much fun doing them. Right? You used to go out on town and party hardy. Or maybe you weren't a partier. Maybe you're one of those picnic people that love to picnic. Or maybe you're one of those people that love to play instruments. I'm a violinist. Maybe you're one of those people that used to like to craft. I have a friend that crafts. She and her daughter, they craft. They do a little stitch art. Beautiful, by the way. But all of a sudden you say, I don't want to do that anymore. And then people are noticing, wait a minute, they're no longer doing what they used to do. Like, what is going on with them? And they're very concerned. All right. So those are 2. Now we're on to number 3. Significant weight loss when not dieting or weight gain. A change of more than 5% of body weight in a month or decrease or increase in appetite nearly every day. In children, consider failure to make expected weight gain. All right. So let's start with the children. If your children are not gaining weight and they're not eating, something's wrong. Okay? Something's wrong. And we're going to get more into childhood disorders, definitely, as we go along this makeup and mental health journey. But specifically in children, if you're seeing a change in your children and they're not gaining weight, that's a problem. And you'll find that out by taking them to their pediatrician. Because the pediatricians will go ahead and chart. They will chart your child's weight on a scale. And if your child's weight is not within the correct percentage, they'll let you know that they're not gaining weight. And this is how we get the much needed referrals. Okay? You've got to take your children to see the pediatrician. Okay? Everyone, take your children to see a pediatrician. You got to get health care. If you don't have health care, then talk to someone at your job or in your family about getting health care. Okay, if you don't have health care, you could always go to the market as well, because we all have to have health care, right? And for children, they can get health care. Okay, all right. You may want to start with the health department. Okay, if you don't have insurance, then they can guide you. Okay, but we definitely need all of the children to be insured, so you could take them to their doctor. Okay, and when you take them to their pediatrician, the pediatrician will ask, how have they been feeling? Have you seen any changes in the child's behavior? And so that is your point of contact for children. Okay. All right. Now let's move along. Insomnia or hypersomnia nearly every day. Insomnia, I've been there, right? We have insomnia sometimes. Sometimes we can't sleep. Now, insomnia, it can come at certain times of life, okay? Insomnia can happen to us all. But if you're sleeping too much over 8 hours a day, over 10 hours a day, okay, you're sleeping 12 and 16 hours a day. Now, some of us have to catch up on sleep, but I mean every day, nearly every day, okay, for the last 2 weeks. You can't sleep at all, or you're sleeping too much. That's problematic, okay? That's not normal, all right? So, how you sleeping? The average sleep hour for adults should be 6 to 8 hours a night. Basically, fairly uninterrupted, okay? Now, some of us have to get up and we have to go to the restroom and things like that. And I understand that. Okay? But for the most part, you should be able to get at least 6 hours of sleep at night if you gave yourself the time to get it, okay? That doesn't mean you're going to sleep at 12 because you couldn't go to sleep earlier. That means that, you stayed up, up at night. You're trying to go to sleep. You're tired, but you just can't go. Or you're waking up in the middle of the night consistently. You're waking up and you're like, man, I just can't sleep. Okay, that's a problem. It's a problem. All right, so that was number 4. Number 5, psychomotor agitation or retardation, nearly every day observable by others, not merely subjective feelings of restlessness or being slowed down. So not just saying, man, I feel restless, or man, I'm slowed down today. Psychomotor agitation is a restlessness where other people can see you fidgeting. Okay, it's like an irritable restlessness. Psychomotor retardation is a sluggishness. And that kind of sluggishness, oh my goodness. You say, oh, I just can't get it together. My arms feel heavy. My legs feel heavy. Man, what is going on with my energy? I just feel sluggish. I feel super duper sluggish and I can't walk up the stairs like I used to. And maybe I go to LA Fitness and it takes me, a whole hour to burn 350 calories, where before I was able to burn calories very easily. I was able to run and do other things on the treadmill that I'm not able to do anymore. Okay? Is that you? All right, we're counting. Okay, that was number 5. Number 6, fatigue or loss of energy nearly every day. You find yourself like this every day for the last 2 weeks. It's not normal, okay? That's not normal. Not normal. Nope. Not normal. Needs to be treated, okay? So fatigue. Man, fatigue is kind of rough because fatigue is one of those constitutional symptoms. Fatigue can be indicative of a lot of different things. You say, why am I tired? Well, maybe you stayed up too late last night, number 1. Maybe you just didn't get enough sleep. But if this happens and you're tired every day for 2 weeks or longer, it's a change from your previous level of functioning, then you can go ahead and check that and say, oh yeah, that's me. All right? So fatigue or loss of energy nearly every day. All right, I want to stop there and I want to say something about this pandemic. Because if you're working at home like me, just seems like we just get more increasingly tired throughout the day, right? We just get tired. And then we're like, why do I feel tired? Why do I feel so tired? I just feel tired. Are you exercising? Who's exercising? I am. At least 2.5 hours a week. 30 minutes walk a day. Okay. Also, people say, how can I get my energy up? Are you taking multivitamins? I would like for you all to take vitamin B12 and folic acid or a multivitamin, or talk to your primary care about how you can increase your energy level, because there could be something off. You could have other things going on with you. Okay. And I'm not an FNP, a family nurse practitioner, so I try to stay in my lane. I try to stay in psych. I try to stay in the psychiatry lane, okay? So if you come to me and you tell me things like, man, I'm so tired. I'm so tired. And I haven't felt this way before. Or, man, I'm so tired. I can't get my energy level up. I'm going to say, have you seen your primary care physician? Have you seen them and told them how tired you are? Have they run any lab tests on you? I'm not going to go into, you could be anemic. Oh, no. That's not my lane. That's not my lane, okay? I don't know if you could be anemic or not. You could be anemic. You could be a whole lot of other things. So first, I would send you to them and say, hey, you need to get some tests done to see why you're so fatigued, especially if you have a family history of thyroid issues and things like that. Oh, believe me, I'm going to send you over there first, and make sure that we fix that first. Because I'm going to tell you, if it's a thyroid issue, there's no medication I can give you to help your energy level out, okay? You have to supplement the thyroid hormone, okay? That's not psych. That's not psych, okay? That's actually family practice type stuff, okay? That's not psychiatry, okay? But in psychiatry, we do identify. We have gone through the medical classes. I've gone through medical classes. Ooh. We used to call them the weed out classes. Ooh, I'm having flashbacks from school, y'all. Ooh, whoa. Those medical classes, woo. But they should be rigorous, okay? Because you're dealing with people's lives. So yes, we are able to identify when we need to refer you to the family practice physician or when we need to refer you for medical diagnostics, okay? Because we first rule out medical and then we'll go ahead and treat the mental health disorder if that's what we identify as going on. So, I have sent you to your primary care, or I have come and said, I looked at your labs and everything seems pretty good. Yes, we do order lab tests, okay? And I say, I've looked at your labs, everything was really good. So then I'm going to say, we need to get some vitamins going or start a medication that will help you feel better, okay? Especially if this is due to major depressive disorder, okay? Because then you need an antidepressant. All right, next. Feelings of worthlessness or excessive or inappropriate guilt, which may be delusional, nearly every day, not merely self-reproach or guilt about being sick. No. These feelings of worthlessness, hopelessness, helplessness, inappropriate guilt. They originate from somewhere, okay? When it says, which may be delusional. Yes, you could be so depressed that you're delusional, that you're thinking things and you're fixated on things that are not true, okay? Now, this is not psychosis. That's a totally different video, okay, guys? Totally different. I'm not saying that this is psychosis. However, someone can be so depressed that they experience elements of psychosis. We're not saying schizophrenia. That's totally different. That's a totally different set of diagnoses, okay? We're not saying schizophrenia. What we're saying is feeling so down that you're delusional, okay? Feeling so down for so long that you're delusional, okay? Not merely self-reproach. Now, you know how some people are just down on themselves. They're just down on themselves. They think they're bad people. They say, I hate myself, and that's their personality. They haven't changed from what they used to be. If they're always self-reproaching, then they're always self-reproaching. They may have a pessimistic outlook on life. That just may be their personality. They won't have any of these other symptoms. They are just, or maybe they feel guilty about being sick, you know. So it's not merely just feeling bad, like, oh, I'm sick and I feel guilty. Oh, no, no, no. Feelings of inappropriate guilt. You didn't do anything, but you feel like you did. And feelings of worthlessness, okay? All right, that's number 7. Number 8, diminished ability to think or concentrate, or indecisiveness nearly every day, either by subjective account or as observed by others. So let's talk about subjective account, okay? Subjective account? You say, what is a subjective account? What does that even mean, Jazz? Subjective account is how you feel, how you interpret things subjectively, coming from you. Not a complaint, okay? It's not a complaint. Not a complaint, no. It's just an objective account. That's all. You're not complaining to me. You're just telling me how you feel. That's subjective. Now, if I see that you're crying in the appointment, that's not subjective. That's objective. That's an observation that I'm making, that I see. Okay, and we chart those. So if you cry in the session, I'm going to provide you some therapy, you know. If you need some support in the session, I'm going to supply you with the support during the session. I'm not just going to leave you hanging. Now, I'm not a counselor, okay? I am not a therapist. These degrees on the wall, you all don't see anything about therapists up there, okay? No, I'm not a therapist. However, I did study a lot of therapy, okay? And we did a lot of therapy too, you know, in school with each other. So we know all the theorists and we know how to do therapy. And I can supply you with the therapy that you need right then. But if I feel that you require cognitive behavioral therapy or dialectical behavioral therapy or exposure therapy or all the different types of therapies, and we'll go over those in another video, EMDR and things like that, then I'm going to right away say, hey, you need a therapist, because I'm not a therapist. Okay, that's what I'm going to tell you. You need a therapist, ma'am. You need therapist, okay? And I'm not a licensed therapist, but I know who I can refer you to because I know some licensed therapists, okay? I know some licensed therapists. I'm going to refer you to them, okay? I know we're all siloed off sometimes in our own little, silos, but we do collaborate with other healthcare professionals, okay? All right. So, diminished ability to think or concentrate. That's what people say. I can't concentrate. I can't focus. Working at home, people, can you focus? Asking myself that. Yes, you can focus. But then, is it becoming an issue? Okay, now this is not ADHD. Now, this is totally different from ADHD. ADHD is familial. So is depression. Your chances increase. If you have parental figures, your mom or your dad, if they were depressed people, your chances increase, okay? For you to be depressed, okay? So just know that. But also, this indecisiveness. If you can't make up your mind, and you're just like, oh my goodness, I'm being so indecisive. If you can't make up your mind every day for the last 2 weeks, and it's a change from you being you, and you know that for sure, that's a problem, okay? That's a problem. So is that you? I don't know. We'll see. The last one here, recurrent thoughts of death. Not just fear of dying, but recurrent thoughts of death. Recurrent suicidal ideation or thoughts. Ideation is a thought. Without a specific plan or a suicide attempt or a specific plan for committing suicide. This is something that we do assess, okay? We assess this every visit, and I always tell my patients, I'm going to ask you every visit, are you okay? Are you having these signs and symptoms? Are you having suicidal thoughts? I'm going to ask you that. And it's not to disrespect you or anything like that. It is to assess if you are depressed or if you're suicidal. If you're suicidal and you have a plan and intent, oh, you just got a one-way ticket. And it's not a bad thing, but you just got a one-way ticket to the mental hospital, okay? And at that point, that's the safest place for you to be. Okay, let's just get real, y'all. Let's get real. That's the safest place for you to be if you are suicidal. That's the safest place for you to be. Okay. So if you go to a mental health professional and you tell them that you have a plan for suicide, we usually will stop that line of questioning and we'll go ahead and talk to you about going and getting a mental health evaluation at a psychiatric hospital, or even a emergency room where they have psych consultants and psych liaisons, okay? So that is very, very important that you share with your provider that you're having suicidal thoughts, okay? You got to share, y'all. Y'all got to share. Because if you don't tell the truth, that will put you at risk for suicide, okay, if you're not telling the truth, all right? So we have gotten all the way down to number 9. Okay, recurrent suicidal thoughts. That could also be a part of another diagnosis that I will talk about in the future. But we're not going to get into that right now. But I would like to say that if you have anyone that is having recurrent thoughts of death, okay, this needs to be addressed. This is not anything to play with, okay? As we know, suicide rates have increased from ages 10 to 14. They've tripled, okay, since 2010. And you say ages 10 to 14. Suicide has tripled. Little 10-year-olds into 14-year-olds, they're in middle school. These are elementary to middle school. You know, they've had an increase since 2010 by 3. Triple, okay? Triple the incidence of suicide from ages 10 to 14 since 2010 have tripled, okay? And so that is why you see professionals always wanting to do these mental health checks. When you take your children to the pediatrician or a counselor, or you bring them to a psychiatric nurse practitioner or a psychiatrist, they are going to ask you if you have suicidal thoughts, okay? So don't be offended, because we want to help you. And if you know anyone that is having suicidal thoughts, please give them this information. They could call the National Suicide Prevention Lifeline. And pretty soon, legislation will pass where we'll have a number that we can call a 3-digit number. I think it's going to be 988. I'm not sure yet. But until we get that number across the United States, use this number, okay? Or you can go to that website, okay? All right, so we have gone through all of the diagnostic criteria for major depressive disorder. If you have 5 out of those 9, you could possibly have a major depressive disorder. So I encourage you to seek out professional health, okay? I have not diagnosed you today, all right? But I do encourage you to seek out professional health if you feel this way. All right, well, that's it, guys. I've done my makeup for the day. I feel really good. It's not perfect, but it will be perfected. But are our lives perfect? I'll wait. All right, but it's perfect enough for me for today. Join me for my next episode, and each episode I will talk about a different medical diagnosis, okay? A different psychiatric diagnosis on each episode, okay? And so the next episode will most likely be on anxiety disorders, okay? I won't talk about the treatment right now, but we just want to get people to understand the criteria of a major depressive disorder episode, and that this can be treated. Okay, it can be treated. So if you feel this way, go ahead and contact a mental health professional. Thank you for tuning in to Mental Health and Makeup. My name's Jasmine Young, and I am a psychiatric and mental health nurse practitioner. And if you want to come see me, look me up. Google me, okay? I can help you. All right. So until next time, bye.